Hello and welcome everyone to our public health webinar. My name is Ismail Al-Kunaisi. I am the Postgraduate Studies Admin at the Institute of Public Health, United Arab Emirates University at the College of Medicine. Allow me to introduce the title of this webinar, Healthy Aging Perspectives of Older Persons in Malaysia. We are very proud and happy to be affiliated with ASFER, Association of Public Health in the European region. And this webinar is part of the global campaign, This is Public Health. We are organizing this webinar in association with Emirates Public Health Association with the aim of bringing experts and highlight important public health issues. Our webinar is accredited by the UAEU as 1CME. In this webinar, you can ask questions. You can do so by clicking on the Q&A option at the middle bottom of your screen. You can submit your questions during the presentation, and we will try to cover your questions at the end of the webinar. At the end of the webinar, we will share a link in the chat for the evaluation of the webinar. You need to fill this evaluation to receive the certificate. This webinar is being recorded. The recording will be posted on our YouTube channel. To reach our YouTube channel, please search Institute of Public Health, CMHS. Now, allow me to introduce our esteemed speaker from Malaysia, Dr. Professor Siti Anom Ahmed. She is the director of the Malaysian Research Institute of Aging. She is also a professor at the Faculty of Engineering, University Putra Malaysia. She received her PhD in electronics in 2009 and master's in microelectronics system design in 2004 from the University of Southampton, UK. She received her bachelor's in electronics/computer from UPM in 1999. She is also a professional engineer of Board of Engineers in Malaysia, Chartered Engineer of Institute of Engineering and Technology, Senior Member of Institute of Electrical and Electronic Engineering, and member of the Institute of Engineering Malaysia. Her research interests are biomedical engineering, artificial intelligence, Geron technology, and intelligent control system. Dr. Siti, the virtual floor is yours. You can start sharing your screen.
Okay. Thank you very much, Mr. Ismail. So please let me share my screen. So now it's in a presentation mode, right? Okay. Okay, Assalamualaikum warahmatullahi ta'ala wabarakatuh, and a very good evening to everyone. It's 11 p.m. here in Malaysia. Okay, I am Siti Anom Ahmed from Malaysian Research Institute on Aging. Tonight we'll be sharing with the audience tonight on the topic on healthy aging, perspectives of older persons in Malaysia. Okay, this is the contents of my presentation tonight. So I'll start with some definition and framework of healthy aging, and then followed by situation of in Malaysia on aging population, our health status of older persons in Malaysia, and national policy and plan of action, and finally towards healthy aging. Okay, first let's see the definition and framework of healthy aging. So this is from WHO. WHO report in 2015. So healthy aging can be defined as the process of developing and maintaining the functional ability that enables well-being in old age. And actually, for this healthy aging, it is introduced in 2015 until 2020, and this is to replace active aging focus by of WHO's work on aging that was introduced in 2002. However, both constructs emphasize the need for action across multiple sectors and enabling older persons as a resource to their families as well as communities. So if we look here, for healthy aging, it comprises of three factors: functional ability, intrinsic capacity, and supported by the environments. And this intrinsic capacity, there are sub-elements that consist of personal characteristic, generic inheritance, and in between there are health characteristics. Of course, there are many factors on health characteristics. And to achieve healthy aging, of course, we need investment from the government. So in this investment here, including health systems, long-term care, it's not just on the health system, but it should consist of long-term care, lifelong learning, age-friendly environments, and also social protection. And based on this investment, we want to see what are the benefits that we will receive. And in return, the most important thing is the returns from the investment, which include individual well-being, workforce participation, consumption of the resources, and it can provide entrepreneurship and further investment, innovation, social cultural contribution, and social cohesion. And if we look here, I mean, we know that in older persons, there are different capabilities. Are they high and stable, declining capacity, and significant loss capacity? So based on these capacities, we can, based on the investment, we can prepare, we can take different approach. Either it is for prevention, for as of course for the high and stable capacity, or treatment and management of diseases only, based on these three: health services, long-term care, and environment. So of course we have different approaches, depends on our older person's capacity. And this is also based on the WHO report on aging. And this is from WHO Southeast Asia Regional Framework on Healthy Aging, that they want to promote healthy aging and care of the aged through life course with dignity, looking at these seven factors: rights of older peoples, gender equality, reducing inequities, ageism, age-friendly primary health care, long-term care again. And to achieve this, of course, we need to adopt a multidisciplinary and multi-sectoral approach. So this is on healthy aging. We in Malaysia, we refer a lot on WHO framework on healthy aging. Next, let me share on aging population in Malaysia. So as you can see from this graph here, the aging population in Malaysia is very rapid. So now we are in 2023. So Malaysia is aging society. So the definition of aging society is when the percentage of population of older population, in this case is 65 years old and above, is 7%. So Malaysia now is in aging society, and we are projected to become age society by 2045. Someone raised hands. So should I stop, Ismail? Is it okay?
Hello, yes, you can continue.
Continue.
We'll
Okay.
take questions at the end if
All right.
someone wants
Okay.
to raise
Sure.
their hand.
Okay. So now we are in aging society, and we are expected to become age society by by 2045. I mean, by 2045, our age older persons population will increase to 14%. And if we look here, bottom here years, it takes Malaysia 25 years to change from aging society to age society. However, from age society to super age society, it will take Malaysia only 15 years. So this is to show to everyone how the population aging become is a rapid it happens very rapid in Malaysia. Okay. And then if you look into, this is the pyramid, age sex pyramid in Malaysia from 1950 to 2050, we can see how the shape from pyramid shape become like rectangular shape, which shows the increasing numbers of older population in Malaysia, and increasing numbers and increasing proportion of older persons in Malaysia. So this is related to my previous slides. So there are two factors that contribute to this. One is decreasing fertility, where younger generation, most of our younger generation decide to have less children or no children at all. And the other factor is increasing life expectancy due to the improvement in the healthcare systems in our country. So if we compare the total fertility rate in Malaysia between 1969 and 2021, we can see that how how different are they? From 5 reduced to almost 2 in 2021. So the number become smaller. And then this is the life expectancy between male and female in 1969 and 2022. So in 1969, average they can live up to 66 for female, but in 2022, it has increased to 76 years old for female. So we found that female can live longer compared to the male older persons. And if we look, even though they can live up to 76 for female and 71 for male, we also look how many years can older person expect to live in good health. So this is, we call it HALE, okay? We look in Malaysia. Okay, so even though they can live longer, but they can live healthy. If you look at birth, they can live healthy until 67 and 65. And if they live, and if you look the HALE at 60 years, they can live healthy at this 15 for female and 14 for male. So we know that even though you can live longer, but you still have health issues. Okay, this is, I share again life expectancy at birth Malaysia between 2012 to 2022. So you can see that it's a slowly increase, but there is a decline in the life expectancy between 2020 to 2022. But and I believe everyone knows this because there is increased the number of excess death during the peak of pandemic COVID-19. So this is our data from Department of Statistics, Malaysia. And when we look further into the health status of older persons in Malaysia and issues and challenges, so I think this is very similar with other countries. The most common health issues in older persons in Malaysia is hypercholesterolemia, which about 76% of our older persons have these issues, followed by high blood pressure and diabetes. Okay, these are the three common issues. And then in the same time, they also have worrying depression issues among our older persons. So for female and male, they are about the same, about 12% and 11%. But those without spouse, those who are living single or the persons living singles, shows a higher percentage having depression. And dementia issues in Malaysia is about 10% of the older persons have dementia, where female shows higher percentage compared to our male older persons. And then this is another worrying issues, common issues in our older persons, where there are false incident. So from our survey, 1 in 7 seniors had at least fall one time in the last 12 months. So that means from all the total population, 72% from the survey, 72% of older persons fell once, and about 28% fell more than 2 times. And from this all fall incidents, more than 50% need to go to the hospital as outpatient or hospitalized. And other factors, other health status that we look into our older persons in Malaysia is on their underweight or obesity. So it shows that 18% of our older persons shows obesity, has obesity, and only 5% is underweight. And 11% show muscle wasting, that means they are not active. Okay, and risk for malnutrition also shows higher percentage compared to the malnutrition, 7%. And we also ask our older persons, are they happy or are they unhappy? So we can see here the comparison, which those who live in rural area are more unhappy compared to the urban. So we can understand that usually children, they work in the urban areas, so most of the parents, most of the persons live just them in the rural area, in the hometown. So this might cause of why they are feeling unhappy. If we compare between male and female older persons, they shows about similar percentage of unhappy. And between married and single, okay, this is relate to my earlier slide where single older persons, they are more unhappy compared to the married one. The previously I've shared about depression issue where older persons without spouse have more depression. So from this survey also shows that single older persons, they are unhappy compared to the married one. And same with this one, older person who are unemployed shows unhappy sign compared to employed older persons. And if you after that, okay, and if you look all that health status, of course you need treatment. If you have disease, have issues, you need have treatment. And then we look into, and then we found that how they want to it covered insurance coverage of older persons, and then have insurance coverage. And we found that our older person, mostly they are uninsured, and very small percentage they are insured either private health insurance or insurance that is employer sponsored health insurance. That means in Malaysia, if you are government retirees, even after you retire, you still you still entitled to use the health facilities covered by the insurance. So as we can see here, they have the main they have many health issues, but they are uninsured. And then another parameter that we look into about health insurance, we relate it to their household income. So household income is the total income of a house, of one house. And then we divided it into different quartile. While Q1 shows the lowest income and Q5 is the highest income. And then as we can see here, the lower household income, most of them are uninsured compared to the highest income. So how they want to do? So this is the issues that the government have to look into. So from here, we can see that, okay, from my previous slide, so those who are in vulnerable groups, they have limited preferential access to healthcare because they are uninsured. These vulnerable groups are the age 50 years and above, and those with low household income. And then because of this, they still need the health coverage. They still need that health treatment. Okay, they need to tap into any financial resources such as a savings to enable private inpatient care, or if they don't have it, they have to continue accessing the public healthcare in Malaysia. However, they have to go, which is under pressure from congestions, because there are many citizens that still using public health care compared to the private health care. So if you look here, this is, I mean, in Malaysia, healthcare utilization. Okay, in Malaysia, we have public facilities and also private facilities. And when we look into the income of total Malaysian, we divided into three groups. As you can see here, there is a B40, below 40. Below 40, that means 40% that have low income. Middle 40%, middle 40% that have middle income, and T20 is the top 20 group. So this is like richer people in the top 20 group. So as we can see here, the B40 and M40 group, they utilize the public facilities higher compared to the T20 group. And why did they go to the hospital? 74% came due to related health problem. So Okay, so as I mentioned earlier, utilization of public hospital, public facilities was largely by B40 and M40 groups respectively. Okay, so this is just to share again how where were the people admitted to if they need treatment for their health, for any health issues. And as the government, okay, government to support this, to support the healthcare system, we have in Malaysia, we have different national policy as well as a plan of action. So as we can see here, I would like to share among the policies, laws, and key public actors related to aging on older person. So we have one national policy for older person. This is where we talking about how to promote active aging, healthy aging, uh, active. There are five supportive aging. I can now at the moment I can remember three only: healthy aging, active aging, supportive aging. Uh, Maybe I can share the other two later. And then we also have national health policy for older persons, and then one physical planning guidelines for the elderly. Okay. And then the key public actors. There are four key public actors. The first one, the main one is Ministry of Women, Family, Community Development. But this one more on the welfare. So they are looking into the vulnerable groups and for B40 groups. And we also have Ministry of Higher Education, Ministry of Health, and Ministry of Urban Wellbeing, Housing, and Local Government. Okay, in Malaysia, every year we have National Day of Older Person that we celebrate on 1st October since 1991. And we also have different legislation to support. I just share some of them. Rules for the management home for older person. So this Care Center Act, Private Healthcare Facilities Service Act, Pensions Act, Employees Provident Fund, Retirement Fund Act, and also the latest one, Private Age Healthcare Facilities and Services. So all this legislation, all these policies, uh, how the government taking action based on the issues and challenges related to aging and older persons in Malaysia. So we also have another plan of action that been developed to support healthy aging in Malaysia. So, for example, we have here National Strategic Plans for Non-Communicable Disease introduced in 2016. So this action plan was formulated because the government, the country want to combat the NCD issues, which shows the highest contributor of health problems among adults in Malaysia. And all these strategic plan, of course, to address health problems and the risk factors and sets out direction that will shape an environment that is conducive towards healthy aging in Malaysia. Okay, and then maybe I would like to share about national health policy for older person in Malaysia. There is focused on four objectives. The first one is to improve the health status of older persons. And then objective 2 focus on the prevention, where we want to encourage participation in health, in promoting and disease prevention activities throughout the life course. The third one is seamless healthcare services, so that we want to provide holistic manner at all levels in healthcare. And objective 4 is enabling the environment, where we want to advocate and support the development of enabling environment for independent living, aging in place. And because one of the findings, older persons in Malaysia, they like to age in place. They don't want to stay in residential care. All of them they prefer to aging in place. Therefore, we as the government and us are responsible to provide the support so that our older persons can age in place. So all these policy as a commitment to ensure that our older persons will achieve optimal health through integrated and comprehensive health and health-related services. So this is 11 Malaysia plan, RMK 11, so a government plan where they want to better supportive environment for the elderly in promoting healthy and active aging. So this is where we at MyAgeing plays important part in supporting this initiative, where we can hope to provide the right anchor to our population aging phenomenon. We identify area for improvement and also changing the mindset of the population on what are the real solution and what are temporary ones in enhancing the living environment and supportive environment for our older persons. So maybe next I would like to share a bit about our uh, place, our institute, Malaysian Research Institute on Aging. So MyAgeing, we are the National Research Institute that is responsible to conduct not just research and programs, not just research, but also programs in the field of aging and older persons. So our goal is to become the intellectual and physical hub in research, development and commercialization, human capital development, as well as professional services in the field of aging to improve the well-being of not just the older persons, but the family and society. So earlier in my presentation, I have shared 3 roles of MyAgeing. So to achieve this goal, we focus on research and development, education and training, as well as professional services. So this is the main goal of MyAgeing. And sorry, I thought I have shared. This is the roles of MyAgeing. So we have 3 niche areas: social gerontology, medical gerontology, and also gerontechnology. And then we also, MyAgeing is the secretariat for our Malaysia Aging Research Network in Malaysia or Oman. So for education and training, we provide masters and PhD research, masters and PhD courses by research in these 3 fields: social, medical, and gerontechnology. And we also provide capacity development to professional, semi-professional, older persons and caregivers through training or workshops, and also professional services, either it's academic or non-academic events. And we provide consultation to multiple agencies, private and government agencies. These are some of our consultation on integrated care model for the elderly and also age-friendly cities in communities. These are 2 that I shared. Okay. And in MyAgeing, we are focusing on 5 well-being dimension of older persons. I mean, to achieve older persons, usually we are talking about economics and health, but from our findings, not just these 2, but they are the 3 that contribute to the well-being of older persons. So of course, economics, health, social, spiritual, and also environment. So our focus, our programs focusing on these dimensions. Okay, so the research program that we have, that among the research program that we conducted based on the field social gerontology, medical gerontology, and gerontechnology. So I will not read detail, but you can see from here. So earlier, Mr. Ismail has introduced me. My background is engineering. So I'm focusing, most of my research, I'm focusing on gerontechnology, from smart technology, wearable device, just to support the aging innovation for our older persons. And the findings from all the research, we have 1 unit called Age Care Experimental Unit. And this unit responsible, this is our platform for translational research. So based on the evidence that we obtain from the research, we implement it for the community, for the country. So, and then in providing services, focusing on the well-being of the older persons, family, and the society. And this is our building in MyAgeing building. So we call it as MyAgeing Integrated Complex. Why integrated complex? So we integrate many facilities that could support aging process, research in aging and older persons. So we have laboratories, we have living lab, food preparation lab, and then we have this horticulture lab as well, therapeutic garden. And these are among facilities that we have in MyAgeing Integrated Complex. So we have daycare center, we have, as I mentioned earlier, therapeutic garden, we have multimedia lab, we have training and computer rooms, we have rehabilitation lab, ergonomic lab, physical functional lab, social behavioral lab, and I mentioned earlier food preparation lab. So all these different facilities and how we can conduct research or research based on that three fields just now uh, can be carried out in MyAgeing Integrated Complex. So these are, I like to share. We just moved in here in 2019 and end of 2019. So in early 2020, the whole world was hit by pandemic. So we slowly furnish all the lab with all this equipment. So this is the physical functional lab where we have our gym here. Our gym here, mostly the attendees are older persons. Okay, and we have our rehab lab, ergonomic lab, where we study on the fall incidents among older persons, balance, and then we have daycare for older persons. So we have one center for our, this is for research and also services to the older person among the areas. And this is living lab. Living lab is where we want to provide care model. As we know, our older persons, they have different different capacities. For independent older persons, for semi-dependent older persons, bedridden, and also dementia. And this living lab is not is for research and training facilities. And in here, we we want to develop integrated care system model. We want to provide connecting various sensing devices, place that can be replicated in all the person or patient's home, using cloud platform to storing outpatient or patient, all the persons or patient information. And this is mostly for healthcare monitoring. And this is how we want to support our national healthcare policy on seamless healthcare. So we want to show the care model for different capability of older persons here. So this is our living lab. And we also have this one, our activity center. Our senior citizen activity center is its offsite facility located in other states in Malaysia. So we receive one story bungalow, and then we transform that into activity center that is age friendly. And at this place we we conduct various activities, but based on these well-being dimensions on economy, health, social, spiritual, and environment. So as you can see from some of the pictures, we conducted various activities, and they are attended by the local communities at this place. But if you notice, most of the attendees are female, and we are still uh, promoting this place so that we can have more males to attend the programs in this place. And this is also become our place to conduct research, and we conduct activities, and in the same time we conduct research on the older person's participation. So this is also part of to promote healthy and active aging among older persons in Malaysia. So this is also our one of our translational platform. And this is, I would like to share, this is our signature program. We introduced this program in 2008. This is a platform for lifelong learning for our elderly. So as you can see, they are students attending classes with different classes, but it is informal learning process and support and cooperation of various sectors. So we are still now they are run as their own. We introduce them in we introduced this program in 2008, but in 2011, they to sustain as a sustainability, they run on their own and form as a NGO, non-governmental organization. But they still working very close with us, and they have an office in our premises. And this is another one that we do, digital literacy. This is also, we have started since 2008 to use technology, but the recent one is we develop modules, digital literacy for older persons, contain 5 modules, and how to use mobile devices. We know that during pandemic they can't go out, so we developed this module based on the survey that we conducted, what they want to learn. We look into mobile. This one, the module 1 is to introduce mobile devices, basic knowledge of mobile devices, and from the mobile devices, they can use it for navigation and tracking, communication and messaging, how to do online shopping, e-wallet and self-checkout machine, and trusted. And the 5th module is trusted content online services like online banking. So this is, we teach them so this is part of our initiative to empower our older persons. And these modules can be downloaded for free from our website. And this project is supported by UNFPA. And this is, okay, we also provide trainings and services, okay, programs. So in Malaysia, we know that many older persons, they live alone at home, so they need companion. So in Malaysia, there is one social enterprise that provide companion services for older persons. But then the gig workers, the workers, they don't have experience on how to handle older person, because you still, even though you can take care of them, but you need a skill, knowledge on how you can communicate with older persons, how to, it's different with how we handle kids. Okay, so these are the trainings that we provide for the gig workers, different topics, some of them on communication, how to take medication, if they are using wheelchairs or ambulatory equipment, how to move them from house to the car, and then healthy diet menu. So all these, some of the modules, some of the content that we give in the trainings to our caregivers. And then this become one of the issues in our aged care in Malaysia. We don't have skilled workers. Okay, and then there are many initiatives among us, among the network, on how we can develop a care module that can be used by all caregivers in Malaysia. And then, okay, so I think I've shared about MyAgeing. So this is towards healthy aging. So what we have done, based on the definition of healthy aging by WHO, and then in this one, we always refer to this UN Decade of Healthy Aging Plan of Action. It's a 10 years plan, okay. And then of course this one is related, it was developed based on the MIPA, United Nations Madrid International Plan of Action on Aging, and aligned with United Nations Agenda 2030 on SDGs. So in this healthy aging, we want to foster healthy aging and improve the lives of older people and their families and communities. We are not just focusing on older people, but also their families and communities, because there are many evidence that show that now not just older persons have mental health issues, but also the caregivers, due to lack of knowledge, due to the stress in caregiving. Okay, so fundamental shift will be required, not only in the action, but how we think about age and aging. So the Decade of Healthy Aging, they focuses on 4 areas to change, for action, change how we think, how we feel, and act towards age and aging. Ensure that communities foster the abilities of older people, and deliver person-centered integrated care and primary health services responsible to older people, and provide access to long-term care for all the people. And this is relevant SDGs related to for healthy aging. SDG 1, 2, 3, 4, 5, 8, 9, 10, 11, 16, and 17. So more than half of the SDG. And rethinking of program government in supporting healthy aging. I mean, government of course plays the important role as the provider in designing, providing or modifying the public services, funder, investment, regulator, and also legislator. And we need to work, they need collaborator. That means they cannot work alone. They have to work with others to build evidence and develop ideas, and steward a sector through influence and information, and client in buying goods and also commissioning services. And as a conclusion, as we know, I think this is happened worldwide. The rate of population aging is accelerating. And Malaysia, as developing countries, we have to adapt to this aging population much faster. Okay, and then we have to optimize functional ability as this is the key to healthy aging. And in Malaysia, we need to invest in healthy aging as it can yield valuable social and economic returns, both in health and well-being of all the persons. Okay, and the government, of course, responsible for implementing policies, financial arrangement, and accountability mechanism in creating age-friendly environments and build a health and care system that could improve the life of older people, families, carers, and communities. But this is not government's responsible alone. The civil society organization, businesses, community leaders, we also play key roles in ensuring local ownership of plan and the engagement of diverse stakeholders in achieving healthy aging. And this with population aging, the aged care sector, we can see this in Malaysia. Nowadays, the aged care sector is going to grow steadily, and we need to transform our approach to caring for our older persons for the age. So that's all from me. Thank you very much. So I can be reached. We can contacted to this platform. Okay, that's all, Mr. Ismail. Thank you very much.
Thank you very much, Professor Anom. It was very thought-provoking presentation, and you know, you covered a lot of issues, and really it was an eye-opener. So I just want to remind all the attendees, you can write your questions in the Q&A section. If you want to speak up, you can raise your hand. We have one question. Can you share more details on how spirituality has impacted elder persons from your research?
More details, I mean, I can share verbally. Okay,
verbally,
so,
yes, verbally.
Okay. So spiritual here means, I mean, Malaysia is a Muslim country. Okay, so I can share on this. We have three main races: Malaysia, Chinese, and Indian. So there are three main religions. So each one, they have their spiritual activities. Okay, for example, for Muslim, we have like recital Quran. There is one activity, one day for recital Quran. And then one day they have a Jemaah on Duha prayer every morning. And then they have a talk and all. So that is usually, and then and as you know, through this spiritual activity, it actually becomes social activities for them. And then this is, I mean, but we notice that our older persons in Malaysia, they focus much on spiritual. We want them to do more than spiritual, like exercise. It's very important to them too, because so that's why we have to achieve the well-being based on that five dimensions that I've shared earlier. I hope I answer your question.
No, it was a very good answer.
Rashid.
Mr. Rashid, yes.
Yes.
Professor Michael Grivna, he's the chair of our institute. He raised his hand, so you can open your mic if you have any questions, Professor.
I hope it will be. Can you hear me?
Yes, we can.
Yes, can I hear you? I can hear you, yes.
So I'm really very pleased with your presentation. It was really incredible how many activities are you doing, especially with the technology involvement and so on. I have like two questions related more on the economic support for the aged population in the Malaysia, and especially now in the Europe, there are many countries which have the similar problem with aged population, and they would like to do the pension reforms to have the retirement age in the much older, and there are many manifestations now in France, in Czech Republic, other countries with increasing the retirement age. I would like to ask you in connection, what is the retirement age in Malaysia, and how is the pension somehow process is made? So it is first question. Second, you were mentioning decreasing fertility. I think it is many countries now have the challenge with fertility rate decreasing, which has the consequence that then it will be less income in the taxes, and so support for the pensions, for example. Are there any attempts to increase fertility rate to support the young families somehow economically to have more children and so on? So there are two questions. Thank you so much.
Okay, thank you, Prof. Grifna. So for the first question, the retirement age in Malaysia is the compulsory retirement age as for government workers is 60 years old. That is our official retirement age in Malaysia, but in private you can work longer. Okay. However, that is our retirement age, and then the definition of older persons in Malaysia is 60 years old. So in Malaysia, we have two sectors, private and government agencies. So this is about pension. I mean, for private agencies, private workers, we have EPF, Employee Provident Fund. That means they take about 9% for your salary and keep it in the EPF can be used after your retirement. So there is like your big saving for private workers. But for government agencies, we have pension after you retire at 60 years old. So you will receive your salary as usual, but there is a small percentage from your last salary before you retire. So that is how we for government workers we have that pension, and this pension until you die. You will receive the pension until you die. So at the moment, talking about social protection, I mean the government is thinking how we can reform the social protection in Malaysia, because one is, as I mentioned earlier, decrease in fertility and life expectancy. So that means if you have many older persons, many government workers, you have to pay the pension longer, and then it will affect the government expenses. So now, and then about for private agencies, recently during the pandemic, many were affected, many were retrenched, and then we cannot, they don't have income. So government allow us to withdraw from that EPF, and due to that, their savings decrease, and there are worrying issues. Is afraid by the time they retire, they don't have enough savings. So for example, we are projected to live longer, about 77 years old. So is the savings in that EPF enough for your retirement? So this is still a very strong discussion in Malaysia. And at the moment, there are two. We have that one, EPF, and also for EPF for private workers, and pension for government workers. And for the second question, what is the second question?
Second question was about fertility. If there are some programs or the country supporting, increasing fertility.
Yes, in Malaysia, the fertility rate is below the replacement level.
Right, right.
Depressment level. And then we have one agency in Malaysia that is responsible again to promote, to increase, to support. We don't have any financial support like I think other countries they have. If you have small kids, a government will give some support, some benefit, but not yet in Malaysia. But not yet in Malaysia. And then just at the moment we just promote, to advocate, to inform the countries, to inform the citizens that our fertility rate is decreasing. In the future, in long run, we may have like Japan, super age society, and then we don't have, it's not good for the country. But maybe in the future, I believe maybe the government could introduce some benefit to encourage our younger generation to have more children, to increase the
Thank you.
fertility.
Thank you so much. I think it is very similar here in the UAE. We have the really very similar somehow demographic trends, and we see
Yes, I think this is a
incredibly
whole world
fast.
issue.
Right, right. So if Ismail, can I have another question? One question, I think
Of course, of course.
sorry, and the one question is related. You were showing that there is like quite a high proportion, I think it is in all countries, about the fall-related incidents and injuries, which are really quite big burden on the people and also on the healthcare system. Are there any approach, like somehow prevention approach, what you have or you developed related to the fall prevention among the elderly?
Yes, me myself working on this fall detection. We know that fall, cause of fall related to balance in there. So of course we want to there are different approach. One is the detection and prevention of fall and balance, detection of balance so that we can prevent fall. And some areas we look into the flooring type in hospital, the types of flooring, because even in hospital we have many fall incident in the geriatric patients. So we're trying what types of flooring, and this is what we're working with industry to introduce this sleep flooring, anti-sleep flooring, yeah.
Yeah, I think it's important to consider the fall, and it's part of injury prevention in public health as well.
Okay, there are many questions in the chat.
The chat, they're all thanking you for the amazing presentation, and they're quite happy. Mr. Rashid wanted to open his mic. If he still wants to speak, I have allowed you to unmute.
All right, thank you. So, thank you so much for the presentation. It was really insightful, impactful, and it was very engaging. And I believe that some of the programs that are being implemented in Malaysia are things that other countries can actually replicate, and that's quite interesting. Yeah, but I think I've seen some of them. But the most important thing I wanted to ask, because there's a policy review that we were working on national adolescent health in Nigeria, for example, and some of the board members of the policy decided to remove spirituality among the thematic areas for the development of the policy. So when you mention spirituality, which I argued with them at that particular time, that I feel like it is relevant, and every society believes that whatever your religion is, it has an impactful way of helping you manage your health and a whole lot of things. So that was why I asked that question. Aside the meeting up maybe in the mosques or for Jumat and all those activities, is it that there are some practical things that they're learning from the recitation of the Quran that helps them, that influences their health and that demography at that particular time? So that was why, because we are removing it here, which I believe is relevant. But you are saying in Malaysia that it has really worked for you guys, and it is one of the key things. Among the thematic areas I draw on that on the chart there. So are there particular things about it that that maybe we can use to convince or other societies that are removing this from their own curriculum or their policy intervention programs? Thank you.
In Malaysia, we have, like I mentioned earlier, we have national policy of older persons. And then in that national policy of older persons, we have plan of action. What we have to do to support that policy of older persons. There are 5 strategies in that plan of action. And one of them is more on the lifelong learning and spiritual is included in there. So it's in the government policy. So this is spiritual not just for Muslim, but for all other religions. As so is that so you can so when it is there, so it's not just government initiative. This is also supported by all CSO NGOs that perform this to support this spiritual strategy. They have in this plan of action we have different strategies, and in each strategies we have programs. So this is how it's not limited how you want to do it, and depends on how you want to do it, but the government always support, even in that activity center that is supported by the government
I agree,
program.
Professor Anom. I think the approach should be for the whole community and not just a specified type, because
Yes,
the aging is. Yes. So we have one last question from the chat. Are there any guidelines regarding elderly living with obesity?
So there is no guideline, but as I mentioned earlier, again, we have another policy, national health policy of older persons. So in that national health policy, the second objective, I think, is on the prevention. So in the prevention, it's more on advocate on programs, how we can promote healthy diet, healthy menu and all. So this include the older persons with obesity issues. So we don't have specific, but it's all comprises in that national health policies for older persons.
Okay, we have one last question. What are some common myths or misconceptions about aging that you would like to dispute or comment on?
This is issues with ageism, right?
Yes.
Yeah. So ageism, we have to remember, even though the older persons, they are old, maybe they have issues, but they still can contribute. They are not, and they're also, in terms of technology, they are very excited to learn technology. For example, the one that I shared earlier, digital literacy that we have developed, they are very excited to learn. Communication and messaging is one, of course, the top one. But then they are happy to learn on how to navigate, how to do online shopping, and of course, we have programs with older persons, how we teach them. It's a gardening urban farming project, but in that project we incorporate, we teach them how to become entrepreneur from urban farming, how to generate income from urban farming, and during that farming process we teach them how to use all this technology to purchase online, how you can get cheaper equipment, cheaper supply using online shopping compared to the physical shop. So that is how we do it.
Yes. So you were just mentioning, maybe there's a follow-up question from my side. What are the most pressing challenges facing older adults today in terms of health and well-being? Because as you said, they can contribute to the society. There's less expectation, as you mentioned, ageism. So what is the most, in your opinion, challenges they are facing currently?
For urban areas, they have no problem to have access to all this knowledge, to all these facilities to learn. But the question, how we can reach out to the rural areas. So they should, if you look at WHO framework just now, there is one on these equities. So we want everybody to learn. We don't want to differentiate between rural and urban areas. So that is I think one of the challenges we are MyAgeing want to tackle. So everybody can learn, everybody can get the benefit, because sometimes there are benefits from the government does not reach them because they don't have the knowledge, they don't have the access compared to the people in the urban areas.
Yes. Well, it's a very interesting topic. We can go on, but unfortunately the time is coming to the end. At the final remarks, I would just like to thank you very much, Professor Anom, for accepting our invitation and for the excellent and very valuable presentation. I want to also thank all those who made this webinar possible. Management of our college at the United Arab University, the organizational and technical team. On the head of the team is our great supporter, Professor Michael Grivna, Dr. Azhar, of course, for her continuous support, Mr. Al-Sajir, Dr. Ifat, Mr. Amino, Ms. Bayan, Ms. Khadija Al-Belushi, Ms. Mariam Al-Niadi, Dr. Saif, and Dr. Jazla. And thank you all for attending and for your active participation. We really appreciate you coming and listening to this webinar. The link for the evaluation of the webinar has been placed in the chat. Make sure to fill it to get the certificate. Our next webinar is in May. We will announce it on our social media, so please follow our LinkedIn, Twitter, Instagram, and Facebook at UAU IPH. You can find the recording of this webinar hosted by the IPH at our YouTube channel, as I mentioned before. Please search on YouTube, Institute of Public Health, CMHS. We look forward to seeing you again. Thank you again very much, Professor Anom, for the great presentation. Keep well, stay safe, and goodbye.
Okay, thank you very much, everyone, and happy Ramadan. Next
Ramadan
week.
Kareem.
Okay.
Ramadan
Okay.
Kareem.